hours from now till 12.
It's a beautiful Tuesday, and I'm so excited because today is public holiday. So a lot of people are sitting at home listening, listening from their houses and all that. Children, nobody went to school today, right?
No.
Yeah, so it's public holiday, and happy public holiday to everyone.
More like happy Eid al-Maulud. I think that's what today is. Yes. So it's Salah for our Muslim brothers and sisters. So hopefully, I don't know if this is the one they killed the ram or not, but yes, make sure you have a fantastic celebration.
Yes.
And dwell in all of the importance of why the Salah is being celebrated. Yes. Anyways, we're going to go right into what we have for today. Today we're going to be looking at health issues as usual, and we've got Dr. Uzochukwu Chetachi, who is a general medical practitioner with Nizamiye Hospital. You're welcome to the show today.
Thank you very much.
Yeah, she looks amazing, by the way. She's a supermodel, guys. Like, I can't remember the last time I saw a supermodel as a medical doctor, so I'm feeling really, really, really good right now. And she's dressed the part, by the way.
Thank you very much.
All right, so today we're going to be looking at dealing with infections with a focus on tuberculosis and then, of course, HIV in Nigeria.
Yeah.
Right. So, tuberculosis is something that some people don't even know that exists. Like, some people, when you tell them tuberculosis, they're like, what is that? You get, some people will say, is it whooping cough? Some other people will say, like the first time I really literally heard about tuberculosis, I didn't really get what it was. I mean, it sounded like something that was far away.
Far off.
Yeah? I don't know if you get that a lot as a medical doctor, do you?
Yes, I
You do, right?
Yes.
Okay, so I'd love that you please explain to us in very simple terms what tuberculosis is.
Mm-hmm. Okay, tuberculosis is an infectious disease that usually affects the lungs and is caused by a bacteria called Mycobacterium tuberculosis.
Okay.
And then when one is infected, it usually affects the lungs, but can also spread to other parts of the body.
Okay.
So that's basically what tuberculosis is.
Oh, wow. Okay.
All right, you've just defined tuberculosis. Tell us what the causes are as well, the symptoms are. But I wanted to dwell more on the causes of tuberculosis right now. Okay, telling us the major causes, what causes it, and how can you identify someone who has tuberculosis?
Okay, the major cause of tuberculosis is the bacteria Mycobacterium tuberculosis.
Right.
And then the symptoms that one has when one is infected is a chronic cough that has been there for about 2-3 weeks. Just coughing and coughing and coughing.
Right, that's why some people think it's whooping cough, yeah?
Yes.
Right.
Also, some people think it's just the weather.
Okay.
Then unexplained weight loss.
Right.
It's not that you are doing fit farm stuff and you're just losing weight.
Right.
You are coughing.
Right.
And then one is producing copious sputum with blood in the cough. Yes. And then other symptoms entail drenching night sweats. At the night, it's not that you have blankets on. The night is cold, but you are sweating. Then progressive low-grade fever. You just feel ill. And it's not that you have malaria, it's not that you have typhoid and all that, just low-grade fever. So those are basically the major symptoms of tuberculosis, especially that has affected the lungs. But if it has spread to other parts of the body, like the kidneys, one can come down with what we call some renal symptoms, retention of water. If it has spread to the spine, has what we call Pott's disease, spine deformities, scoliosis, kyphosis. It has spread to the brain. One can have unexplained seizures, paralysis in one part of the body. So tuberculosis is really a disease that everybody needs to know about because it spread fast, and when it spreads, it does damage a lot of organs in the body.
Look, I wanted to ask, I was expecting, what about weight loss? When you have tuberculosis, does it also add to you losing a lot of weight?
Yes. That's why I said unexplained weight loss. It's not that you are doing fit farm dish and all keto diet, blah blah. But one is just losing weight despite you are eating well, and despite being in a maybe good environment, you're just losing weight. And then coughing for almost 2-3 weeks.
Wow.
Right. So is it treatable, and are there services that are available to those that are infected?
Yes. Tuberculosis is treatable. Presently, there is the TB strategy control by WHO called DOTS. That is directly observed treatment short course.
Right.
That's where many antibiotics, very strong antibiotics, are used over a period of time to treat tuberculosis.
Right.
Now, it depends on if one is a newly diagnosed patient or if one is a relapse.
Right.
There is a time frame spanning from like 6 months, about 18 months, depending.
Oh, wow.
But it's readily available. And then, sorry, I forgot to mention about how it is spread.
Right.
Yeah, it's spread by droplets of when an infected person coughs, sneezes, or talks. And it's spread to people.
Disease, yes.
And then when people around that person that is infected have been exposed for a very long time, people around that risk of contacting tuberculosis.
Oh,
That's
wow.
why most of the time when someone is coughing, I'm always like, please, can you cover your mouth?
I know.
I've actually had a patient
Yes.
that came down with tuberculosis, and we had to do contact tracing, and we found out that that patient's colleague at work actually had TB.
Oh my word.
There was also another child that had TB, and when we did contact tracing, we found that that child's class teacher had TB.
Oh, wow.
Yeah.
So something we need to be really wary of.
Yes.
Really well.
Just in case you're just tuned in, this is Rhythm 94.7. Today we usually would have Healthy Tuesdays, and this particular segment of the Mid-Morning Cruise is actually powered by Nizamiye Hospital, and we have the delectable, very intelligent Dr. Uzochukwu Chetachi here, who is a medical practitioner with Nizamiye Hospital, and we are talking about dealing with infections with a focus on tuberculosis and HIV in Nigeria. So far, she's explained what tuberculosis is, how you can actually, trace, if you have the disease, the causes, the symptoms. And we've had symptoms like coughing, we've had symptoms like sweats when there's no heat, we've had symptoms like weight loss, you mentioned, and all of those kind of things. So we've also... Now, let's look at the prevalence with children. You mentioned a child that came down with tuberculosis. Is this something that you've noticed that is very common amongst children?
Yes, I've noticed it's common amongst children, especially those that have the risk factor of malnutrition.
Oh.
Yes, because when a child is malnourished,
Right.
the child's immune system is low.
Yes.
And when he or she is exposed to one that has TB, especially an adult that has TB,
Right.
the child is more likely to come down with tuberculosis.
Wow.
Yeah.
All right, for you to join the conversation, all you have to do is to send a text to the number 081-78000947. Send us a text on that number or call that number to ask questions, any questions you want to ask about tuberculosis or HIV. Go ahead, call us on that number 081-78000947. Call that number or send a text to that number. All right, Doc. The goal of Nigeria health sector and the WHO is to end tuberculosis and different epidemic diseases in Nigeria by 2020. From the stand we are right now, do you think anything that is achievable in 2020 or anytime soon?
Yeah, we always look at the bright side.
Right.
Okay.
And yes, we always look at the bright side. So yeah, I believe it's achievable, but with more government policies and sustainable goals, we'll be able to achieve that. Like I initially mentioned the DOTS strategy.
Yes, please, you did.
TB treatment.
Right.
It also entails financial and political will by the government. It entails that the government provides a lot of health centers where standardized treatment is given.
Right.
And make sure that those patients that have tuberculosis are really, really monitored, and make sure that they take their medications as at when due, and then the drugs are always available.
Right.
And then there is proper recording and reporting of cases for contact tracing.
Now, talking about these drugs, are they readily affordable?
Yes, they are. Most of them are even free.
Oh, really?
Yes, in DOTS clinics in general hospitals, most of them are giving free or at very subsidized rates.
All right.
Yeah.
Wow. Okay. So we've talked about the goal of Nigeria's health sector to be able to do what they have to do before or by 2020. Now, let's look at the steps that we can take to achieving those. You mentioned the DOTS. Are there any other programs in place? You mentioned national hospitals have all of this, medication readily available. Is there any awareness or any campaigns being done?
Yes,
because I feel like
every year the TB World Health Day is on the 24th of March.
okay,
And then this year's theme was Wanted Leaders for a TB-Free World.
right,
So basically, there are various policies and strategies in place to end TB in the world, and also in Nigeria.
Right.
So by the time the government and people, and especially what Nizamiye is also doing, by enlightening the public about the prevalence and incidence of TB, then people would be able to own up their health and make sure that, okay, if you see anyone that is coughing for a very long time in your environment, or your bros, come make you go hospital.
Seriously.
If you see one that is malnourished, and if you see one that, especially those people with HIV, they are, facts say that 50% of people with HIV/AIDS, they have 50% chances of contacting TB. Of all the about 1.4 million people that have HIV/AIDS in the world, or 140 million people, about 50% of them are at risk of having tuberculosis.
All right, Doc, you started talking about HIV, but I want to ask, okay, because we're still talking about ways to prevent and curb tuberculosis. And as well, in recent times, it's been discovered that tuberculosis even kills faster than HIV. Can I just wake up one morning as healthy as I am, to going to any hospital, decide to go to any hospital to test for TB, to know if I'm positive or negative, just the same way people walk into different hospitals to run tests to know, different...
They have malaria,
if they have malaria and all of that.
Yes, you can.
Yes.
You can. But one of the major...
Should we do it often, or...?
No, it's not something that should be done often. In medicine, we usually marry clinical symptoms with laboratory investigation. So even if you come and just part of your checkup, we may just do a mantle test for you, or just simple as a chest x-ray can show signs of pulmonary TB. But one of the major preventable ways is by vaccination. And the vaccine is BCG vaccine that is given at birth.
And is it just once?
Yes, just once. But the issue we have is that, especially in rural areas, hinterland, in fact, there was a time I went for an outreach somewhere in Abuja where there is no service. When you get there, your phone goes off. There is no healthcare service around. So how do you expect children giving birth to at home to be vaccinated?
Exactly.
Especially, it's supposed to be given at birth, or at most a week after birth. So that's one of the major preventable ways. Also, I've initially mentioned about the government. The recent insurgency has given ways to a lot of IDP camps, overcrowding, and in those IDP camps, we know that they may not get as much healthy meals as possible, and they are prone to be malnourished. There's overcrowding, and then it also promotes spread of tuberculosis. So as much as the insurgency is on, the government should just help us so that those IDP camps are well aerated. Even in the houses, anyone building houses, your houses should be well ventilated. Make sure you eat well. Make sure you go for regular checkups, as simple as a chest x-ray. If you've been coughing for almost 3 weeks and it's not abating to normal antibiotics, please go for a checkup. We have tests, especially in Nizamiye Hospital, like chest x-ray, mantle test. We have GeneSpark, TB quantiferin. Those are investigations that can be done to detect tuberculosis in people.
That is a lot of information. I am actually being educated right now. Reading 94.7 is the dial. If you want to call us, 081-78000947, or you can send us a message on our WhatsApp number 090-947 78243. Those are the numbers you can reach us on. For anyone who's listening right now, we're looking at tuberculosis and its prevalence in Nigeria and the things that can be done, to curb the effects of tuberculosis in our country. So we're going to move real quickly to HIV. It has been, the campaign has been on, to some extent, we'll say the average Nigerian on the street, 1 in 2 Nigerians know about HIV. That's like a massive campaign that has been going on. But now let's just identify some basics again. This is for the purpose of anyone who probably doesn't understand what it is, because we can't assume that everyone knows. Now, what's the difference? You just quickly go by the difference between HIV and AIDS, and then the risk factors. Of course, we know one of the risk factors is tuberculosis. So just tell us the difference and the risk factors and the things that we should be looking out for when it comes to HIV and AIDS.
Okay, HIV is the virus that causes AIDS. It's human immunodeficiency virus. Why AIDS? It's like the end stage of the HIV spectrum. That is acquired immune deficiency syndrome.
Let's see if you can take this call.
Okay.
We lost that one. Just in case you want to, ask a question, the lines are open. We just lost the call, but 081-78000947. That is the number you can call, or you send us a message to 090-947-78243. You can continue, please.
Yeah, so I said AIDS is like the end stage of the spectrum of HIV infection, which is acquired immune deficiency syndrome. So the risk factors, one, immunosuppression, when one's immune system is low, and then it's rampant amongst people with diabetes. People with diabetes have a low immune status. People that engage in chronic steroid usage, those have low immune system.
Can you explain that chronic steroid usage?
Taking steroids, some people take steroids to enhance fitness. Yes, but the complication is that it tends to lower one's immunity. Yes, so that's it. So other risk factors to contracting HIV infection is having multiple sexual partners, whether homosexuals or heterosexuals, engaging in illicit drug usage, sharing of sharps, needles, clippers, and also one major way is by maternal to child transmission. That's why it's very important that every woman that is that goes for booking for antenatal must be tested for HIV. So that if she's positive, depending on her viral load and CD4 count, we're able to know whether she'll benefit from heart or not. Thank you.
All right, Doc, I have a question here from Amina. Amina is from Maraba. She said, my father has tuberculosis and all of that. But I want to ask, please, doctor, what is your name? And we've been treating it for a year plus now, and it's not getting better. And a lot of people tell us is old people's sickness, that he just has it because he's old. But we've been treating for like a year plus now, and there's no improvement. Please, where can we see you if that can actually help get the matter better? Please, I'm trying to understand what she's saying, but she's trying to say how she can see you, for a better solution.
One of the major challenges that we have in treating tuberculosis is poor patient compliance. So it may be that he may have not been compliant with the medication because it's actually a very long course. 6 months, 18 months with strong antibiotics.
All right, Doc, let's just take this call. I think she might be the one calling. Hello.
Good morning.
All right, good morning. Tell us your name and where you're calling from.
Anonymous. I'm calling from Jersey.
All right, Anonymous, please go ahead.
Well, I've been once a victim of this tuberculosis.
Okay.
So, and I was unfortunate to meet Society for Family Aid last year.
Okay.
Which they gave me a full 9-month treatment. 9 or 6 months, without any breakdown of the drugs. So after the 9 months, they took me back to the lab. I was tested and I was confirmed tuberculosis free. I believe I didn't pay. I was paid to be treated either. So I still want to answer that girl's question that tuberculosis is not for elderly people. It's for everybody, and she's at risk. So I
because of her father.
Sharing some things with her father and some things. I don't think it's for elderly people alone. Thank you.
Thank you very much.
Yeah, that's a good testimony.
Yes, it is.
Tuberculosis is actually curing.
And then it was so true because he said he went through a 6 to about 9 months course, which is what you mentioned.
Yes.
And you almost felt like they paid him to take the treatments. You didn't need to pay so much. Right. So, I mean, if you're listening, like Doc already said, maybe it's the consistency and the attention to how your dad is taking his treatments.
Yes.
If he gets very disciplined, I'm sure he'll be able to get an end to the ailment.
All right, Doc, I have this question, and this is coming from Stephen. Okay, there's no location, but he just said, is coughing out blood also a symptom of tuberculosis?
Yes, it is.
Okay.
It is a symptom. Okay. And then that sputum, we usually take it for tests to rule out the presence of Mycobacterium tuberculosis in the sputum. We do what is called acid-fast bacilli or Zionelson stain, or sometimes we culture it with some culture medium.
Coughing out blood, does it mean you've gotten to that chronic level?
It means that it has really affected the lungs.
Okay.
Tuberculosis really affects the lungs. At a point, it causes what we call damaged lung syndrome, as in the lungs is just chopped off.
And how long can it be for that to happen? From the point on when it starts, how long do you think that could take for us?
It depends on the immune state of the patient.
Right.
Like in HIV, in infected persons, it takes like months.
Right.
Just months.
Right.
In other people, it can take like 5-10 years to get to that.
So they could be living with this for 5-10 years. I'm not know.
Infected.
Oh, wow.
I'm sorry, infective. So
right. It's progressive.
Just spreading.
Oh, wow. A lot of education going now. We're going to be going straight to treatments for HIV. Are they accessible? Where can people access them? I understand that you don't even pay for the treatments. Or do you pay for that now?
No.
HIV, no, they're still free, right? So please help. For anyone who has the symptoms of HIV, where can they access treatments? And we also need to emphasize the growing rate amongst young people.
Young people.
Yes, I understand that right now, Nigeria is number 1 or 2?
Number 2.
Number 2. So please, Doc, help us spread this message one more time. You're the doctor.
Okay, it's very important that people are not tired of hearing that HIV is real.
Yes.
It's actually very real.
Right.
Very real. And so the spread amongst young people is because of the increased rates of multiple sexual partners, illicit drug use. Should we take the call?
Yes, please.
Okay, it's a message actually.
Okay,
the person sent a message. Said, please, I'm asking for someone. I want to have kids, but I'm HIV positive.
Right.
Is it possible for my child not to be HIV positive?
It's very, very possible. And that's why I mentioned that every woman for antenatal booking should be tested.
Right.
And once she's tested and she's positive, she'll be placed on some medication for the time being of her pregnancy.
Right.
And then her pregnancy would be planned. Her delivery would be planned.
Right.
So that there is no crossing of blood from the child to the mother. And then even when the child is born, the child is placed on some prophylaxis treatment for a period of time.
Right.
Yeah, so it's very possible. I've had patients that have been successfully delivered of HIV negative babies.
This question is actually funny. Okay. But there's no name. And the guy is asking, does condoms prevent HIV? That's just what he said.
Yes.
Does condoms prevent HIV?
It's one of the preventive measures because it's a barrier method. So it prevents, it just prevents,
Is it 100%?
Will I say 98?
Yeah,
it's
98.
close to 100.
Because even if you look at people that use that to prevent pregnancies, you see that sometimes people will still complain that, I used the condom, but for some reason, I'm still pregnant. Like if we use that as a yardstick, so I don't think it's 100.
It's 100, about a 98, but it's still very, very good to prevent. Yeah.
All right, doctor, I have this one, and I think this is the final question. Okay, and this is coming from Stephanie. She said, a lot of people have stopped talking about HIV. Maybe because a lot of people, they think, maybe because they think a lot of people do not have it again. Are there some public awareness going on in your hospital that you guys do all the time for HIV patients?
Yes,
this is one of it. We are here covering this program, and this is why we're talking about it right now. Like I said, people think, it's something that we shouldn't be talking about, but HIV actually is a serious thing. It's real.
Very real. It's very real. I see patients almost every day.
Oh wow.
Almost every day infected with HIV, and even those that have progressed to AIDS. And then most times when those progress to AIDS is because they were not detected early, and then they did not start HART, that is highly active antiretroviral treatment early.
Right.
That's why they tend to progress.
Right.
So as you asked earlier, how can it be prevented?
Right.
Early testing is key. Don't be shy. Don't be shy. No, even what if I'm positive? Yes. What if you are
But
positive?
it's treatable.
It's manageable.
Manageable. Yes. No, you know how it is. I'm thinking because I know someone who has that's would manage the illness for a while. If you see her, you would never know.
Never.
I've known her for years. She's like dear to me. You would never ever know. She just sticks to her, her drug plan. Like
I've also had patients, couples that are both positive, that have raised negative children.
Oh wow.
Yes.
Oh wow.
So it's actually not the end of the world.
Yes.
That's also what I want to tell people, so that they'll stop stigmatizing.
Yes, we're going to discrimination and stigmatization.
No, I beg this person get it. No. It's not the end of the world. You can actually live your normal life.
Right.
Just that you're positive, or just take it as I'm positive. Like take every day as being positive. You can have HIV negative children. You can achieve anything you want to achieve. Just make sure you are regular with your medications and regular with clinic follow-ups. Because with clinic follow-ups, we tend to check the patient's CD4 counts, viral loads, and then tweak the medications based on what that patient's investigation results show.
Wow.
Okay, it's amazing how time goes by so fast. I just looked at the time, 36 minutes to the hour of 11. And yes, so we're so thankful that you came on the show today, Dr. Uzochukwu, and you've taken us through to the importance of tuberculosis. Like I said, I'm one of those people that used to think it's very far away, it's not anything close.
It's very
but
close.
Trust me, from everything you said right now, it feels like it's very, very, very close to us.
Yes. All right, Doc, thank you so much. But in a nutshell, I want you to talk to someone out there who has tuberculosis or who has HIV. Yes, just say one or two things because we're running out of time. Just in a nutshell, just conclude everything you've said today.
Okay, to those that have TB or are battling the infection, and those that have HIV infection, I just want to say that all is well with you. It's not the end of the world. As we rightly said, tuberculosis is treatable. So make sure that you are regular with your medications at the time you're supposed to take it, when you're supposed to take it. Do not relapse, because relapsing would cause a more serious treatment plan. And then for those that are HIV positive, it's also not the end of the world. You can live your normal life. Just be positive always.
All right. Thank you so much, Dr. Uzochukwu Chetachi. And this program is powered by Nizamiye Hospital, and will bring you a Healthy Tuesday every Tuesday at 10:05 here at the Mid Morning Cruise at 94.7 Rhythm FM Abuja. Our normal programming continues with, of course, Blossom Martins and Awesome Man.
All right, so you're going to stay for this one. The next song you're going to be hearing, of course, is still an entertainment time for us. We're going to be looking at DiMarco right now. Why you should go out there, and if you feel like you have any symptoms, you feel like everything is not well, you've heard everything that Dr. Uzo has said this morning, you just want to go out there and do a check. I mean, it is better late, right, than never.
Yes, better late than never.
Right. Okay, so this is how we're going to be doing right now. DiMarco right now on the Mid Morning Cruise.
I saw the thing go. I'm here this link. Party of his stop keep. Sorry, crafty with the map stick. Yeah, party with the clock spit. We lucky players no hard see any locksmith. Pass see any hot spliff. Mouth make me talk so many chat dish. Tell bright light fi walk with every casket. Swear to God, me nah left any hostage. No. No some juvenile we bust out their face right now. Right now. No some bad girl me set up your case right now. Yeah. Show me where them dead. Carbon fiber bust out that. Yellow tape, white sheet and spread.
Identify with the rhythm on Rhythm 94.7 Abuja.
Tune in every Tuesday from 10:05 a.m. on the mid-morning cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
Back to the music.
It's like this.
More music, less talk, less talk.
The best music.
Thank you guys. You're the best radio station ever.
94.7 Abuja. Abuja. One place. Got your attention.